Hi everyone, I hope you are having a good day. So, today we are going to talk about Viking Therapeutics. So, this company is in a very interesting space. They are into the weight loss segment, one area which is dominated by two big giants, Novo Nordisk and Eli Lilly. And Viking is a pre revenue, company which is in the experimental stage. They are, they're going to enter phase three pretty soon and so I wanted to discuss what is their opportunity and so on. So a disclaimer: this is not financial advice. The views expressed here are my own. This content has been created for educational purposes only. The content may contain errors, and the users are expected to verify the same. So if you look at the weight loss landscape, as I mentioned, Novo Nordisk has Ozempic, Eli Lilly has Monjaro, and these two drugs are dominating the market space. And as you know, there is a frenzy to get these drugs. Originally they were created actually not for weight loss but for diabetes, and everyone wants them to reduce weight, and that side effect has actually opened a big market opportunity for these players. And many of you might already know Eli Lilly and Novo Nordisk have been competitors for, I don't know, maybe last 75 years, 100 years. So they have been there for quite some time, fighting against each other in similar segment. Uh, Novo Nordisk is extremely focused on diabetes. Eli Lilly has a slightly more diversified portfolio. So it's a big market, growing market. In fact, in US, it's still a growth market. It has not reached maturity. In other parts of the world, it's very much a nascent stage. Uh, like in markets like China and India, with big populations, this drug has not been introduced yet. So it's a pretty big opportunity, global opportunity for this particular drug, and Viking plays in this particular space where they're trying to develop a drug. So as we talked about, they have finished phase two. Okay, now they will start trials on humans, and which is phase three. So phase three is all about. They have shown impressive results. If you look at 14.7% and 8%, which is the oral drug, which is again the differentiator. Apart from that, they also have some other pipeline called Nash and areas. So they are kind of they have a healthy pipeline, and they are making good progress. And if you look at uh, once if they they go through all the process, they are able to kind of get the drug approved by FDA. It's going to be there for almost the whole decade of 2030. So they will have enjoyed that patent protection. They can grow their business, and so that is one key part. And they don't have any roadblocks that of or any case something like that where Eli Lilly or NVO are going after them for any infringement and so forth. So they have a product pretty seems pretty solid. It has to go through all the other phases, but so far the progress has been quite good. So if you look at this particular drug, and the current stock price is at around $30. And as you know, weight loss is such a big market. Many players they want to enter, like Pfizer, Merck, AstraZeneca, Amgen, Johnson and Johnson. Many of them have talked about their interest in getting into this market. Now, Viking has a drug which is ready for phase three. Okay, so they have already done a lot of foundational work. So at the same time, the current stock price is $30, but they have already rejected offers, with around 80 $85 of offer, which they have not taken. Means that they have so much confidence on their current pipeline and their chances that they will be successful in this particular market. So that is one part. So it's in this particular scenario, it won't be kind of a small acquisition, because they have a market cap. And if I kind of just check what is the market cap, is the market cap is 3.4 and at $30. So this will be at least a $10 billion acquisition. If you just somewhat think that if they are acquired at $100, it will be kind of close to $10 billion. So it's not going to be a small acquisition. So very few companies can afford it. So mainly it can be done by only big pharma, some of the names which I have listed here. And at the same time, the other consideration is if the other pharma, big pharma, is also have created their own solution or their own formulation, their own molecule for this particular purpose, probably they will not go for it. So there is a very limited set of players who can come in and do that. So that is the risk. But there has been interest in the past, so that is a distinct possibility which can happen. So moving on, and if you look at their management uh, deal in this particular case, so there are people who believe in this particular product and are working through it. Some of the other things, one part which I want to mention, they raised cash when the stock price was 85. So they are very good in terms of, they are pretty safe in terms of their stock. Normally they burn around $100 million of cash every year. Currently their cash reserves, they're 900 million. Means for next maybe 5 6 years, or definitely through phase 3, they are well funded. So they don't have any near term financing needs, and so they are good and safe on that particular front. If you look at their job sites which looked at that, not major things, some small positions in R&D, manufacturers at this point of time, not a lot of hiring. As you know, they're still in experimentation, and they have not got into the ramp up mode. So if you look at most many of the Wall Street analyst firms, they have rated them as buy, and the average value of the company which they have rated as 115. Again, the current stock is 30, so there is seems to be some, it seems to be undervalued if we go by those analysts. So that's what makes it a pretty attractive stock. And so again, the way we see it, that it's in a good space, in a good market which is growing. It has global opportunities. They have a healthy pipeline. It can be an acquisition target, and that they have a good cash reserve, so it's well funded, and so we don't see that they will go for dilution at this point in time. And finally, they will kind of 2025 is a key year for them where they will start working on phase 3, both for their anti obesity drug and NASH and so on. So this can be one area which can really help them. So that's why I feel that Viking as a stock has certain unique attributes, and if you believe or if you think this thesis is correct, that can be an area which you can consider taking a position. So with this, thank you for joining, and and thanks for watching this video.